And it comes as the UN announces its plans to start the second phase of its vaccination campaign against polio in the Gaza Strip. The aim is to vaccinate around 640,000 children in mid-October. And for more on the humanitarian situation in Gaza, let's bring in Dr. Feroze Sidhwa. He signed that open letter to President Biden and Vice President Harris calling for an arms embargo on Israel. He was joined by 99 other medical professionals. Doctor, thank you for joining us. Just first of all, can you describe to us what you witnessed in Gaza?
Yeah, Gaza was terrible. I was there in March and April, and I was in Khan Yunis. It was still during the siege and bombardment of Khan Yunis, and it was pretty bad. I was at European Hospital, which was probably the best resourced block of the Gaza Strip at the time, and it was still just a total disaster. The hospital itself was a displaced persons camp. Electricity was inconsistent. The water was totally undrinkable, even though the hospital had its own water filtration system. There were 1,500 people admitted to the hospital, even though it has 220 beds, half of them children. Every day we had mass casualty events. Every day, and I mean this quite literally, every day I saw a new child shot in the head. And I don't mean like a 17-year-old kid. I mean a young, visibly identifiable as children. It was just an absolute disaster.
Were aid organizations able to help relieve the situation at all, especially in hospitals?
Yeah, the work that aid organizations are doing is very important, and it is making a difference. But what I would hope people can understand is that for a year, the Gaza Strip has been under total and complete siege and an absolutely incredible level of bombardment that has just never been seen anywhere else. Everything in Gaza has been destroyed, and I mean that quite literally. Oxfam reports that like 85 to 90% of the water, sanitation, and hygiene infrastructure has been destroyed. 60% of homes have been completely destroyed. Not just homes, but all housing stock, apartments, houses, doesn't matter. The entire population has been displaced, almost everybody several times. And so the international NGOs, like I went with the Palestinian American Medical Association and the World Health Organization, they can do great work when they're there, but not at the level that is needed because the need is just so overwhelming. Right. I mean this quite literally. I think you could take every surgeon in the United States to Gaza right now and actually build them hospitals, operating rooms, everything else, and they still would not be able to keep up with what's going on. I mean that very literally.
Can I ask you, Doctor, because this is something that we have heard from many of our Israeli guests who have joined us, that they blame Hamas in particular for using hospitals as sites where they run their operations from and thereby putting civilians at risk. Is that something that you witnessed?
No, I didn't witness it, and neither has literally anyone else who's ever been to Gaza. Not a single person ever once, because it's complete nonsense. Mads Gilbert is a Norwegian anesthesiologist and emergency medicine doctor. He worked in Shifa Hospital for decades, literally for decades. And he says he never once saw anything even remotely resembling militant activity. I was in Khan Yunis for just 2 weeks, so maybe I missed it, fine. But like you mentioned, I think at the beginning, me and 98 other physicians and nurses who served throughout Gaza, I think we had a combined total of 254 weeks there. Not one of us ever saw a militant at all.
Can I ask as well, the letter that you signed along with 99 other medical professionals, what is it that you're hoping to achieve with this letter to President Biden and Vice President Harris?
Well, a few things. One is that in the letter we called very clearly for an arms embargo, not just on Israel, but on Israel and all Palestinian and Lebanese armed groups, because this situation is getting completely and totally out of control. That's the main thing. What we hope the administration will actually do is meet with us, and so they can hear what we saw, discuss what we saw, and discuss how changes to policy really need to be made. And there's a few reasons. Number one, I think you just had the Israeli ambassador to Britain or somebody on, but the Israeli military response to everything that's going on is completely out of control, and it's threatening to destroy the entire region. These are completely crazy things that are being done. Like just in August, a major general, I think his name was Yitzhak Brick, he wrote an article in Haaretz saying that Israel is being led by 3 pyromaniacs. It's hard to come up with better words. And so just even from the standpoint of international stability and not leading the whole world into something that could spiral into a nuclear war. This has to be brought back and calmed down and brought under control. So we really want the administration to realize how dangerous this all is.
Understood.
And then from another standpoint, which is just simply that American law is not being enforced. It is illegal to provide weapons, even just under the laws of the United States, leaving aside international law. It's illegal under multiple American laws to provide weapons to chronic human rights abusers.
Okay.
And it's very hard to find a better example than the Israeli Defense Forces.
Dr. Sidhwa, we've run out of time, but thank you so much for joining us on BBC News today.
Thank you.